right now. So my name is Priya Sodha. I do run our career services here at Cal Bright College. I'm really excited to have you all here today. We have a great session planned for us today. We actually have two amazing guest speakers in here. And this conversation is going to be casual. It's going to be conversational. It'll be a group between everyone here. So you're invited to have your cameras on, keep your cameras off. We want to make sure that you feel comfortable and that you can ask any of the questions that you want as you have some professionals in the room. And before I introduce them, I am going to share a little bit more about who they are, but I also want to encourage you. So if you feel like introducing yourself and unmuting, feel free to do so. You can introduce your name, where you're from, and kind of what brings you here today. Or Lucille, thank you so much for introducing yourself in the chat. If you want to also use the chat to introduce yourself, this is helpful for us in this setting to kind of get to know who one another is. So I'll give you that opportunity now to either unmute if you like to, or put it in the chat.
Okay.
I see Ellen. Thank you so much for joining. Hi. Wonderful, Lucille. Yes. Wonderful, wonderful. So today's session, I encourage you to use the chat. If you wanted to say something more about yourself, feel free to do so. I am going to ask our two speakers, Chelle Johnson and Andrea Mcclure, to share a little wave here so you know which ones they are. Chelle right there, Andrea, perfect. And then we have our instructor, Cindy, over here. If you want to give us a wave, shout out. Yes, we know her. So today's conversation is they're going to be answering several questions for you, kind of about the job search. I know some of us are transitioning into this industry, so what to expect, what to look for, how to interview in the process, how to look for a job, ways to network. What does an AAPC membership mean? What does that look like? Why is it important? And then you'll get chances throughout to ask questions in the chat. If you feel like raising your hand and then asking a question directly to one of our speakers, feel free to do so. And before we hand it over to them, I'm going to introduce them briefly and then give them both the chance to kind of introduce themselves and kick it off. So first we have Chelle Johnson. She's over here with our glasses on. She's a professional medical coder and CPC. She has been practicing for almost 20 years. She currently works for Kaiser Permanente as a lead coder 3 for a general surgery team. She's not only a coder,
I think you may have the wrong person.
Yeah.
That's
oh,
not my
I'm sorry,
info.
Andrea Mcclure. Okay, you're like, this isn't me.
Okay.
But works
That's
alongside
me.
peers and management to help the department run smoothly. So this is Andrea. Andrea is a professional medical coder and CPC. Now, Chelle Johnson that we have over here, she has over 25 years of experience as a coding compliance coordinator. Thumbs up, Chelle?
Yes. That's
Okay,
me.
in the medical field, specifically in medical management. So Ms. Johnson serves as an American Academy of Professional Coders, so AAPC chapter president, and sits on the advisory board for the Coding Institute. So all these questions that you might have at AAPC, you can definitely ask the both of them. And Chelle also has some great information and insight on that as well. And I know Andrea has shared that she is a trainer. So I'm actually going to throw this over to the two of them. Chelle, would you like to kick us off and share a little bit more about yourself?
Sure. Like she said, I'm Chelle Johnson, and I work for the County of Stanislaus at the Health Services Agency. My job, I oversee the billers, the coders, the auditors, compliance, and credentialing.
I get it. 5494. Okay.
That wasn't me.
Very good.
Okay. Basically, I oversee all those different divisions. I am with the AAPC. I've been with them for many years now. I have multiple certificates. I have my CPC. I also have my CPMA, which is an auditing one. I have my CPCO, which is a certified compliance officer. I have my CDEO, which is documentation expert. I have a CEMC, which is for specialty in evaluation and management. And I have a practice management certificate with them as well. And I hold an AAPC fellowship. So lots of education with them, lots of certificates. I've been the Modesto, California board president for 3 years, 2018 and then 20 and 21. And I'm happy to be here tonight. I know Cindy through our chapter, And of course, I know on Andrea, she's through our chapter as well, and it was a past president, I believe, or at least on the board for sure. So happy to be with you guys tonight, and hopefully we can answer some of your questions.
Thanks, Chelle. I guess I'll take it over from there. Hi, I'm Andrea Mcclure again. As Priya mentioned, I've been a coder for about 20 years. I work for Kaiser Permanente as a lead medical coder. I'm not just a CPC. I am a CGSC as well, certified in general surgery and ophthalmology. And I'm also certified COBGC for OBGYN. So as we remember these certifications that we have behind our name, we also need to remember we have CEUs that we have to get with all those certifications. So Chelle, you're reading off all these certifications. I'm thinking, oh my goodness, wow.
Yeah.
I give it over to you for all the education you have to get. Let's see, I enjoy sharing my skills and talents with others. And I do this by providing education sessions at work and also at our local AAPC chapter functions. So education and mentoring is really my passion. And so yes, and again, as Chelle mentioned, I've been on the board, again, 20 years on and off, you know, as ebb and flows. And that's where really I enjoy the most networking. That was when we were face to face. But on a personal note, I'm going to give you some personal because I'm a personal person. I just turned 50 this year. Yay me. Cindy and Priya were talking a little bit. I just recently broke my ankle, so I'm learning a lot about my body at this age. I have a passion for human connections and looking forward to building some more connections with you as well. And as we segue into teaching you how to build your network and learning to get to know more people. And so, yeah, that's really about it for that. Yeah.
Thank you so much. So I'm going to kick it off with a question, and either of you can introduce yourselves or answer the question. Is kind of, how did you get into the medical coding industry? Kind of, how did you get into the field?
For me, I started out working triage in an emergency room back when I was 21 years old. My dad worked as a paramedic and a fireman, and he spent a lot of time obviously down at the hospital, and he heard about a swing shift where they were needing a triage person. So I jumped on, and from there, it's always a stepping stone. You never start necessarily where you may end up. So I started as triage and worked in the emergency room, which has lots of good stories. And then from there, I went on to Blue Shield, and from Blue Shield to a local hospital to work in their employee health division. And then from there into the county, and I've been with the county for 22 years now. And you don't always think of working for a county when you think about the medical field, but lots of county industries out there have the health divisions, whether it's public health or hospitals or clinics or whatever it happens to be. But for me, it was my dad telling me that there was a job, and I thought it would be fun to work with my dad for a while.
Wow, that's a great story. That's pretty neat. And my story is honestly very basic. I had my son at 21-ish, and realized that I needed more of a career and not just a air quote, job. And so I thought, what's the best way? I couldn't do it with blood. And so I thought medical office. So I went into our local here, this was back in the 1990s, our local medical office instructing. And so I got into that medical office specialist program. And from there, it kind of pinwheeled or snowballed into where I am now. But I wanted to be honest with you guys, when I first got out, again, things have changed a lot from 1990 till now. But in the 1990s, trying to find a job was very hard. And getting out of the program, I couldn't find anything. And so I ended up going to a temp agency, which could be an opportunity as well. I worked at a temp agency, and I had all these really cool, neat positions, but I finally ended up at one in a healthcare company, and I was hired on full time. And that was my start. So sometimes it may take a little minute, but you get there. So that's how I started.
There's lots of people that start through temp agencies. That's a big one that a lot of groups will use just to see if they can find somebody with the right credentials or the right background. And so that is a really good opportunity. If you're looking for a job, it's not a bad way to go.
Yeah, yeah. They're still around, so.
They are. They
Yeah,
are for sure.
yeah.
Can you tell us about that? So we bring that up. We bring up this idea of looking for a job. How do you get your foot in the door? For some of our students, they're transitioning into this industry. This might be new. What are some suggestions that you would say that would be helpful to today? You mentioned temp agencies, kind of other options or kind of ways that they can get their foot in the door, and potentially places to look for work too.
You know, honestly, there's a lot of different places that you can go. Like I said, you know, most people would think of the county as having the medical positions, but they do. Obviously, hospitals, doctors' offices. The biggest thing I tell people is get a job. Get any job that has the word medical somewhere in the title, whether you're working for a doctor's office, even if you're just doing clerical duties, you know, where you're filing or whatever. If you have that experience, because when they go to screen your application, they're just looking like, do you have any medical experience? And there are some people who want tons and tons of experience of somebody who's been coding for years. And then there's other people who want somebody who's fresh off the boat because they want to train them the way that they need them to work. So there's all kinds of different mindsets out there, but really to get your application in, because everybody says, hey, we want 2 years experience, right? So to get that experience, it just has to be somewhere in the medical field. So I tell people, take that registration job, take that clerk job, take that, you know, swing shift job, whatever it takes so that you have that experience on your resume, because most places will not accept somebody straight out of school with no office experience. Doesn't have to be coding experience, but it has to be some sort of office experience where I'm going to say, you understand what a general day is like. And this last year, I actually did 2 hiring positions, which was unusual. It's the first time I've had job openings in almost 8 years. And in both cases, all I needed from them was 2 years of some sort of medical experience and a CPC. So those were my 2 basic requirements. And we were very lucky. We got lots of good candidates, but that's what I was looking for. And it didn't really matter to me once I got the application on my desk, as long as they passed that 2-year experience and that CPC, then at that point, it all came down to that interview. So that's what I tell people, get any job that has anything to do in the medical industry, and that's going to give you a leg up.
And also networking. I encourage people to, even if you don't have your CPC, to sign up with the AAPC, because you're going to get a lot of resources, a lot of forums, they have a job board on the AAPC. Oh my gosh, what else? I'm just, my mind is whirling with all these wonderful opportunities. Technology now, back in the day, you had to do your pavement pounding, right? Your 8-hour job was pavement pounding, trying to find a job. But now with the networks, I have actually found connections on Facebook for coding hiring. And so these are things that you're just going to have to network to find. Join your AAPC. It's tax write-off. It's because it's for your career. And then as you join the meetings, job postings go out in your meetings. So there's that too. Oh my gosh, there's just so much. I don't know where to, Chelle. I mean, you kind of have to get out there and start joining meetings, even if you're not a member. See, Chelle, remind me, can we be members of 2 or 3 chapters?
I believe it's 3 chapters now. I believe it's 3.
Because I'm with Modesto, I'm with Stockton, and I'm with Palo Alto. And you just network and job postings. As I'm trying to find my words, because I'm so excited for you guys. As a past president and Chelle and Cindy, we get emails saying this job is posted. So we'll send it out to our chapter members. And so it's just really a great idea, even if you're not certified yet, to join the AAPC as a student under the student membership. And you'll get great tons of stuff.
Yeah, the 2 gals that I hired for my office in the last 6 months both came from the Modesto chapter.
Oh, yay!
I mean, that's
Yes.
the bottom line, is that that's where they came from. And I knew them from the meetings, and that also helped out because I knew their experience. I knew questions. They had one gal specifically had reached out to me several times during her coding experience at another office asking questions, because a lot of times as board members, we'll just get general medical questions from attendees or people in our chapter. And our chapter has 400 members, I think. So I get lots of emails each week with lots of questions, but hers, I remember standing out because she had really good, well thought out questions where she had obviously done some research. And so I had that in the back of my mind when I was interviewing her, as I'm thinking, hey, I remember you because I remember those questions. I remember thinking they were well thought out, and it gave her a leg up.
Yes, yes.
So it's a big, basically what Andrea is saying is the networking is meeting people, and what my grandfather used to call glad handing. I remember Andrea from my very first meeting because she walked in and started hugging everybody. And I was like, oh my God, I hope stay over there. But I'm not a hugger. But I just remember her enthusiasm and her excitement and stuff. And so she's a name that over the last 4 or 5 years that I've been involved with the local chapter is somebody that I mean, as soon as I see her name, I know exactly who she is. I can picture her in my mind because she has that enthusiasm and it stands out. And that, like I said, would make a difference to me if she was applying for a job at my facility, because I would remember her and I would remember that enthusiasm. So those type of networking opportunities really make a difference.
You said so many nuggets, the both of you, in this, and so I took some notes. And I want to pick apart this, right? There's a couple things you said. Chelle, you mentioned the interview process, so that's going to be huge. Then we also mentioned Andrea and Chelle both about this networking, right? This networking piece of it. So I'm going to start with the interview process, and then there's this like line that you really talk about personal branding through networking, right? So how do you remember somebody based off of how you see them in networking events and meet them, and then how you build that trust to hire them, right? So when you're interviewing, and Andrea too, when you're interviewing for these positions, what are you looking for in interviews? Because you mentioned, the 2 years of experience, having CPC, and then it kind of comes down to the interview. What are you looking for?
For me, I was looking, I mean, I had, like I said, I had 2 very specific positions, and one of them was a full-time position that was part-time billing and part-time coding. So they had to have both ends of the wheels on that one. And you'll see that a lot of times you may be hired as a coder, but at some point during your career, you may start learning more about billing. And a lot of this is kind of, I always call it like the burrito, because everything kind of overlaps a little bit. You learn a little bit about billing because you got to know that to do coding, and to do billing, you got to know coding, and and then you got to know medical. And so, it becomes, really symbiotic and stuff. For me, when I was interviewing, and I'll tell this one, during my first interview, it was for a part-time position. And I remember this one gal had interviewed, and again, I knew her from the chapter, and she did a terrible interview. One of the things she told me in the interview is that she gets bored easy. That is not what a boss wants to hear. So it's kind of like, gosh, that's just not helpful. But the funny thing is that she had asked for feedback after that when she didn't get the job, and she took that feedback to heart and came back and kicked butt on the full-time position. So I think that every interview is a learning experience. I think it's important to make sure that they see the real you. You can go in and you can give me a snow job and act like you're, the most perfect person ever that's out there, but that's not real. Like, one of the questions I ask is, tell me about a time you disagreed with a supervisor and how you handled it. And if anybody ever tells me they've never disagreed with their supervisor, I automatically take them out of the running, because that is not true. That's just not true. What I want to hear is, how did you resolve that? Did you gossip to your coworkers? Did you, cry about it for 5 weeks? Or did you go straight to the person and say, hey, I'm just seeing this differently, or gosh, I might have misunderstood what you said. What I'm looking for is somebody who is a problem solver, not just in the coding world, but in their interpersonal lives, because a lot of your day, 8 hours of your day, most of the time, unless you're working from home, because different offices work from home, mine doesn't, we all work in the same office together, is interpersonal. How are you going to handle that? Are you going to be a troublemaker? Are you going to be someone who's working for a solution? Are you going to be a team player when you have to jump in? Are you going to complain that Barbara didn't do her job and Lisa didn't do her job and you're just doing everything wonderful? It tells me a lot about you. So what I'm looking for in the interview is, I already know you know how to code because you got your CPC, and that test stinks. I mean, how that 6 hours a day? Oh my God. Okay, so that tells me you already know how to code. That tells me when you come with an education certificate, like what you're doing through this program, that tells me you know how to code. What I'm looking for now is what you personally are going to bring to my office. What is your personality? What are your strengths? I would look at somebody like Andrea and think, wow, that is some energy. She's going to be a great trainer. She's going to be someone who's going to mentor new employees. I've worked with Cindy for many, many years. We were on the board together several years back, and then she took over as president. So she's been around AAPC forever. I know her, and I know how she would interact and her strengths regarding education and her calm, easygoing manner, no matter what happens around her. I mean, these are things that I'm looking for. And it may be that you're just the right fit. Maybe I'm looking for someone like, over the top and excited like Andrea, or maybe I'm looking for somebody like Cindy, who's, I need somebody who's a little bit more, calm, because I already got an Andrea in the office. I need someone to balance it out, or I got Cindy in the office and I need someone to balance that out. You just never know, but you're never going to be the right fit unless you are you. So it doesn't matter really the answer to the questions, as long as I'm getting the real, honest, authentic you. That's my best answer.
And honestly, I have nothing to add. You said it all. That was perfect, Chelle. Well, and the Kaiser, I am working for Kaiser, they do panel interviews. Yes. So be prepared to be in front of maybe 3 or maybe 5 people. And it's okay to be nervous because they already expect that. And that's okay. But like Chelle said, be authentic and be you, and answer as honestly as possible. And if you don't get the job, you're going to learn from that, just like Chelle said. Mm-hmm. Every interview, every stepping stone, I was talking to my daughter the other day. Everything we go through is a resume. We're building a resume, So you kind of just go in with that mentality and just do your best. Put your best foot forward.
And then I was going to add just one more thing really quick, is there's also this mentality. I do a presentation on professionalism. I've actually, with Cindy, have done it with some of her students in the past. And one of the things I tell them is, when you come to the class, come dressed like you're ready to go to an interview. And I will guarantee that 9 out of 10 times, everybody's going to come dressed in black from head to toe. And while black is very professional, it's not going to make you stand out. So what I do when I teach that class is, I've got this outfit that I think I would get it, who knows, but it's green and it's bright and it's cheerful and it makes me feel up, and it makes, and it's good. So when at the end of the day, I'm going to go, you remember that girl, the one in the black? Okay, well, there was 20 of them in black. That's not going to help me. Right. The one in the green sweater. Remember that really pretty green sweater? It leaves an impression. So definitely your physical attributes, as far as, do you come in looking neat and professional? One of the things I tell people is, leave your suitcase in the car. Do not bring your phone into an interview. I mean, don't even power it down. Just leave it in the car. Don't even be messing with it, because what I tell people is, you are on your interview the minute you arrive in your car. I will actually watch people, and I will go back and I will ask staff, my receptionist, my HR people, how was this person in interaction? Were they polite? Were they friendly? Just because you're not in front of me doesn't mean that you're not always already on the interview. So we tell them, from the moment you get out of the car to the time you get back in your car, you are at the interview. People are watching and people are looking for feedback. So it's really important to have that professionalism all the way through, but also remember there's something to stand out with. And you don't want to stand out by coming into the room and having your briefcase and your purse and this, and you got to set this down, and you want to be cool, calm, and relaxed. And part of that is just your physical demeanor. So a lot of times I tell people, hey, lock your purse in the trunk, or pare it down so you only got one thing in your hands. You don't want to be fumbling. You don't want to be the person who's kind of like, it just makes you anxious. It makes the other people anxious. You just want to be remembered as calm, cool, collected, and ready to do business. And there's a lot of that's just the physical thing. Dress so you feel good, that you feel handsome, that you feel pretty, that you feel like, wow, this is my power suit. My color is red. I'm going to wear red. Do something that makes you stand out. I remember in one interview several years ago, this girl, she had these beautiful nails. I mean, just long nails, and they had these things sticking up off of them. And it was a Halloween, and so they were like ghosts and pumpkins and all this stuff. And she didn't get the job because I can't remember anything else about her during the interview, but I do remember those nails. And I remember thinking, you know what? Probably not the thing I would have brought to an interview. I don't think I would want to be remembered because I had a pumpkin sticking off my nail. I would want to be remembered because I was calm, cool, and collected and ready to do business. That's just me.
That's amazing. Thank you so much for that feedback. A little tip about what I do is I listen to my favorite song right before an interview because that just puts a smile on my face and I'm in my own zone. I'm actually going to throw this. Heather has a question. So Heather, would you like to ask the question, either unmute or throw it in the chat?
Okay. Hi, I'm Heather, and this is for either Chelle or Andrea. And I was wondering, what type of training or expectations are of newly certified coders?
Well, I guess that would depend really on the position. As far as, read that question again. Go back to the question. I need to. What expectations?
Training or expectations? Like, do you provide training? I guess maybe for Kaiser. I know my husband works for Kaiser, and so. Yeah, so I was just wondering what type of training or for newly certified coders, do you provide training?
So that's perfect.
Okay.
So if you were to come in as a CPC with Kaiser, there are levels of coding. We have ambulatory coders that do edit clearing. We have level 2 that are E&M specialty coders that do E&M coding and surgical coding. And then we have our lead coders that manage the others and other things as well. But when we came on, we didn't have any training other than our CPC. We were very lucky that at that time we were coding. Kaiser started coding just 11 years, 12 years ago. Because they're an HMO, they did everything internal. Then Medicare came along and said, no, we need to do it. So long story short, when we started at Kaiser 12 years ago, we coded everything. They found systematically it would be easier to break it up into specialties. So at that point, about 3 years into the program, they decided, okay, boom, we're going to allow our coders to choose a specialty and get certified. So if you were to come in now at Kaiser, you would come in at whatever was available and open. Let's say an ortho position came open. Kaiser would bring you in and they would give you that orthopedic coding so that you could have that, that kind of platform of what you needed to learn. So in that aspect, yes. But of course, every company is going to be different, so I can't speak to every company. But a lot of the education is what you're going to get through your CEUs.
Okay, great. Thank you very much. I appreciate it.
You're welcome. Chelle, do you want to add to that what your company does for training?
It depends on the position. A lot of it is, boots on the ground kind of training. We're gonna assign you a desk. And in my world, we have family practice clinics, we have pediatric clinics, we have family planning clinics. We do specialties. So we've got the orthos, the ENTs, all that stuff. We've got a rehab, we've got a public health department. So all that gets thrown at you at one time. We don't break it up. In addition, my coders also are required to be trainers. I work directly with the doctors every day. I'm always out there meeting with them, providing education, answering questions. Some of them are super nice. Some of them are super cranky. It just depends on the doctor. But my job is, I always say I'm a little bit of a traffic cop. My job is to kind of say, yes, you can do that. No, you can't do that. Yes. Okay. Yeah. Okay. But you can go this way, but not that way. And so you spend a lot of time having to explain to people what you do. I always tell people that I'm bilingual because I speak English and I speak coding. And basically what you're doing is you're taking everything that is basically what you're doing is you're taking everything that happened during a visit and you translate that into a bunch of numbers and letters that turns around and goes to an insurance company who takes that information and then decodes it and goes, okay, so we saw a patient for a fractured ankle, we put a cast on it and we told them and we gave them a prescription. All that information gets translated into numbers and letters, goes to the insurance company, and the insurance company says, oh, they saw a patient with a broken ankle and they put a cast on it and they give medications. Okay. So that's what you're doing is you're translating, and it's always explaining to somebody because sometimes the coding world and the practicalities of the medical world. So when I say medical world, I'm talking like when the doctors are like hands-on with the patients, don't always add up. Like it will drive them crazy because there's not always super specific codes. Like they want a code that says the left arm did this. Now ICD-10, we went from 8,000 codes under ICD-9 to over 80,000 codes with ICD-10. So that was a huge jump a few years ago. But with the I can't say that word, specificity. You know that word, Cindy.
Specificity.
That's the word. Thank you.
Yes.
Is now there's all kinds of codes, but you know what? There's still a lot of codes that just don't have that level. So, trying to explain that to a doctor sometimes is not only are you learning, but you're having to take that education and pass it on. So for me, when it comes to boots on the ground and what you're going to learn, it depends on what I have you doing that day. But in my company, we actually pay for your AAPC membership, and I have it built into our contract that we also pay for you to get your webinars every year. So we'll buy you a membership to that. And it's our job to buy you all your books every year. So in addition, I also budget out for the conferences, and I'm not attending HealthCon because I didn't see anything specifically interesting at HealthCon this year, but I did attend a compliance seminar about 2 or 3 weeks ago that was fantastic. So it just depends on what education opportunities are out there. And most years we head down to Anaheim and we go to the conference down there. Cindy was a note speaker one year, so it was fun to see her up on the stage. So, I mean, it depends on what we have going on. That's really what it comes down to, is to answer that question. It depends on your job and what you need to do. But for us, we're jacks of all trade.
Great, thank you so much.
That was amazing. Thank you so much for that. I know we had another hand raised, Kyle, so I want to give you the opportunity to ask a question.
I was just wondering, what is the percentage of coders who code from home as opposed to the office? And then the other question is, how many people, are there like agencies that you work for, or is it, like I don't even know what the question is really, but it's like, are there people that hire people like a part-time at an agency or full-time at an agency, or you usually work for a company?
Yes.
Yeah, I think I understand what you're saying. It depends on the company. Kaiser does a lot of working from home. The employees have the flexibility of coming into I know they have a desk at the office, but they also can work from home, and along with their management staff. In my office, I require my staff to come into work. I'm not a big fan of working from home. That's just our preference. I think what you're referring to is that there are companies out there that doctor offices can hire and have them do their coding. So it's a separate entity. And again, it depends on each office's preference. Some offices say, nope, I want you in here because I don't want to listen to you chasing your dog around the house or be worried about your kids interfering. A lot of it comes down to is if they can put you on a production marker. So if in the office you can code 200 accounts today and you can code 200 accounts from home and still have a good error ratio, then no problem. But if we can't account for your time as a production standard, then most offices will not allow you to work from home. I also personally, and this is just me, I know that this last year with COVID, we've had a lot of working from home and we've gotten used to this whole Zoom thing. I think you miss something when you're not all together. In my group, there's a lot of communication and we talk a lot, and like all of a sudden I'll be yelling out my door, hey, Chris. And she'll come in and it's like, we'll start communicating about something that, are you looking at this the same way? Did you get the same phone call from this doctor? Did you, look at what is your, impression of this new update that came out from CMS? There's been a lot of changes. I'm sure you guys have studied this already, but the new E&M guidelines for 2021, we were all geared up. We went live on January 1st. And since then they've dropped down 2 different updates from there, with additional clarification on what can be accounted for and what can't be accounted for. So it's a constant learning environment. And I think my personal opinion is I think you learn a lot when you work from home, unless you have a really good integrated system. Now I know Kaiser does, that they have a really good communication system, and their managers that oversee them and stuff have a great opportunity, and they do a lot of in-house training and stuff. But I think it just depends on the office. It's a really good way to get experience is to go to one of those groups that do group billing, so that, like maybe they've been hired out by 5 different offices. And so they do billing for 5 different doctors, or maybe they do billing for the hospitals. A lot of places have gone to outside billing companies because it's cheaper than having coders on staff. which is a little bit of a bummer in some ways. But then these other companies, then you get hired at these other companies. So, I mean, I guess it all works out in the end. But it just depends on what kind of experience you're looking for, or if you're not sure where you want to specialize, that's a really good way of going about it to get some experience in a lot of different fields.
Let me segue on that, Chelle. A couple of companies that I've worked for, you have to go into the office for a certain amount of time frame. As Chelle mentioned, you are going to be on production and quality, and there are company standards out there. And so when you go into the office, you have to kind of prove yourself that you can maintain those standards, and then you get to go home. With Kaiser, it was 9 months. We had to be in the office for 9 months because we needed to prove that we can maintain almost 3/4 of production of quality. But there are contractors out there. How quite a few of us got on at Kaiser is we were at another company. I won't mention the company here in Modesto. And because we're on the AAPC website, headhunters, when Kaiser started coding, they didn't have their internal coders. So they went to outside contracting companies. So I don't remember the gentleman's name, I apologize. But yes, I will get the information for Priya and Cindy. There's a contracting company well, there's several all over. Georgia and Florida are the biggest. Texas, Georgia, and Florida are the biggest ones that have contracting companies out there. And most of the time you do have to be CPC, but every now and then you might find one that'll say, we'll work with the person to get their CPC. So you just kind of have to, that's your networking, right? You kind of have to feel your way out there. So it's going to depend on where your networking is and where you end up sending your resumes and all that kind of thing, what the logistics will be when you get hired.
Thank you. That was great. I think Kyle has a follow-up. Go for it. Feel free to.
I just had one other question. Is there any kind of protection that this kind of work doesn't get offshored? Because it seems like this would be something that would be a great offshore opportunity for companies to do.
Yeah, AAPC actually has chapters in India. It's an international grouping out there. A lot of companies have gone to that. Like I know locally we had a group called Sutter Gold. It was pretty big here in Northern California. The only thing that beat us was Kaiser. But Sutter Gold actually outsourced all of their billing, but they did it to a company in Idaho. So what they do a lot is, because California is a little bit more expensive to maintain businesses in, is they will contract with outside billing companies outside of California. So whatever that, so a lot of the billers that used to work for Sutter Gold ended up doing remote work for the company in Idaho. So it was kind of weird, but it works out because it makes certain things cheaper and all that sort of thing. And I just lost my train of thought on what his question was. Oh, outsourcing. Yes. So yes, a lot of stuff does get outsourced, and it just depends on whether they get it outsourced to a company that is trained, such as providers or trainees from AAPC who have CPCs, or if they just go to Yahoo. Now you got to remember that even though you're the coder, you're coding under that doctor's license. So ultimately the doctor's on the hook. So if you mess up, you might get fired, but they're the ones that are going to get fined and go to jail. So they always want to make sure that whoever's coding for them and doing the work for them is someone that they can look at and say, I can trust you. I know you know your stuff. So it's not often that they outsource to people that are not trained. So the two main companies that provide certified coders is AHIMA, AHIMA, and AAPC. And AAPC is gaining on AHIMA every day. You're seeing more and more AAPC and more companies that want the CPC over the certificate from AHIMA. So
and I don't know if you guys know the difference between the AAPC and AHIMA. AAPC, where CPC is for professional coding. That's the doctor stuff. The doctor seeing the patient. Now AHIMA is the HIMSS coders, which are the hospital coders. So they use a different code set. So you may want, and that might be something that you're interested in. But you'll have to look at that side if you're interested in the hospital coding.
I'm sorry, I have a question. Is that considered inpatient coding? Is that what it's called?
Well, you can't, using the word inpatient is kind of hard.
Yeah.
Inpatient in the terminology of facility,
Okay.
if you're coding for the facility is a HEMA.
Okay.
So that's kind of considered inpatient, but not the physical work by the provider. Does that
Okay.
make sense?
Yes.
Okay.
And AAPC does have an inpatient certification
Yes.
for that as well. I'm actually taking my test on Saturday.
Is it CIC?
Pray for me.
Woo!
Pray for me.
Uh-huh.
And that,
Yeah.
so the AAPC does offer that certification as well. So you
Yeah.
could even stay on, with one organization. There are a lot of coders that will have certification from both organizations, just depending upon what they're doing. So.
And you may find auditing is your passion. You may find education is your passion. You may find this field, there's so many avenues that you guys can go in. It's just so exciting.
Thank you for sharing all this. So we talk a lot about AAPC. I know that's a huge conversation. You talk about the resources. I think you mentioned earlier to sign up with it now, even if you are not, even if you have not taken your CPC. So curious, can you share more about it? What are the resources? How can somebody who's not currently a member kind of take advantage on some of the opportunities now and kind of get going with that?
So
it would be fun. Maybe next time you have a meeting, do a tutorial on the AAPC website. That way they can go, like if you go on, I'll come back and do it. I don't care. I'll show them mine, to where you can show them how to do your CEUs, or what forum you can go to find jobs, or ask coding questions or things like that. Now I lost my train of thought. What was the question?
Basically, what are the resources of being part of AAPC? I think for me, the biggest thing with AAPC is, we already talked about, which is the networking, meeting people. But with your membership every year, you also get a monthly magazine that's sent to you, or you can do it electronically online. With that, you can get CEUs just from reading the magazine and answering some questions at the end. In addition to that, if you go to your local chapter, we have up to 6 meetings a year, sometimes more, where you can get free CEUs. So even if you just have to maintain your CEUs, there's a lot of ways that they help you do that. In addition, they provide webinars that for, I think it's like $200 a year, you can get access to all the webinars that are out there. There's workshops, which are 6 CEUs per workshop. And again, it depends on if you're interested in it, you can get access to that. There's forums where you can ask questions. So if you are specifically having trouble, like one of the type of billings that we do is federally qualified health centers. And there's not a lot of us out there. And so when you specialize in that, a lot of times they'll direct questions to you, or you can direct questions to other people that specialize in that specific area to help with that. There's just tons of resources. Like if you need help with, there's a program called Codify that you can purchase through AAPC that helps you narrow down CPT codes and ICD-10 codes and all that sort of thing. And there's and then they also have the knowledge board, which is just these they're kind of like, I call them little short documentaries regarding a specific subject that's come up. So there's been a lot in there lately regarding the E&M changes for 2021. Things like that. So it's tons of resources, tons of information, the job listings. And like I said, it's really important to join up with your local group, your local chapter, because you will meet people and you will learn from each other. Number one, you can ask a lot of questions. You'll find people that you're like, oh my gosh, I didn't even know there was that resource out there. But the most important thing is, especially if you are job hunting, it is a great way to get access to jobs that even though I posted my job online, unless you happen to know to go look on the specific government website to find my billing position, my coding position, you wouldn't have found it. So all the applicants I got were from my AAPC group when I announced it to my AAPC group. So they got a leg up by coming in that way. So that a lot of people will only advertise with their local groups because they want somebody with the CPC. So it's a really good way to get resources. So it's important to show that you have the drive to get your education. And it's important to show that you're going to stay on top of that education by having your CPC and keeping up on those CEUs every year, because that tells me you're not just stagnant, you're learning, you're growing. Getting additional certifications along the way is another really good way, especially if you're looking at promoting, or maybe there's a different area you got into and you're doing E&M coding and you're like, I don't know. Then you can look on the APC website and see what new certifications have come out. One of the ones I hold is the documentation expert, and that is a new one that came out, I want to say 2 or 3 years ago. But that was a new one, and that one is one that has served me very well in what I do currently. And it's something that I really enjoy. I also, one of my biggest things that I love is compliance. And so I became a compliance officer, and it was an opportunity I had through AAPC. And I still go back to the books that I originally learned in, and I pull information from them. In fact, recently I had to provide some documentation to a doctor on the False Claim Act. And I had that information because I had it in my books from my education I got from my APC. So lots of resources from lots of different ways. But the biggest one is making sure people know that you're there and that you're looking. And the best way to do that is to join your chapters and meet people.
Mm-hmm. For sure.
Thank you for that. So are there any questions? I want to open up the floor. Feel free to unmute yourself. Throw it in the chat if there's anything coming up, any questions that you might have. A question you might have, somebody else might also not be thinking about asking. So it could help the group here too.
I just wanted to ask, for the CEUs, you have to already be
Hold your certificate. Yeah.
Yes. Okay.
Yeah.
I just wanted to make sure, because I have been reading the magazines and looking at the questions and everything, but I couldn't remember if that was something you had to already have passed your exam or not.
Yeah, you have to already pass your exam. And the really cool thing about the magazine is that those are other people in the industry. I've actually written for the magazine several times. I've had several articles out there. It's information from people that specialize in a specific area, and then they reach out to us and say, hey, would you mind writing an article on this? And so the information you're getting is kind of what I refer to as boots on the ground kind of information. It's people who are in the trenches every day doing that job, and they're telling you, this is what you need to know to code for that specific area. So it's really, really good information, and just, you know, all little fun facts in there and stuff. But the coding experience, the people that are writing it are really the best at what they do. So it's a really great resource.
Great, thank you.
Kyle, I think you're muted.
He's still muted.
Oh, sorry. It was my clicker wasn't working correctly. Okay. All right. I have a question. I have 2 questions actually. So I have 3 books which I tabbed. According to Sydney, I should tab them. So I tabbed them over there.
Yes.
It took me like a day to tab them all. But anyway, all right. So I know that this is like the main one. This is that. Okay, I can't see it. I know that's the main one. That's
ICD-10. Yeah.
Anyway, that's the main one. What are these other ones for? Why do I have to read them? And,
Because when you because there's 3 coding sets. You've got your ICD-10, which is your diagnosis. That same what's wrong with them? That's the broken ankle. Then you've got your CPT, which is your procedure codes. And these are your E&Ms or the actual surgical procedures. So not only they're saying that here you've got a broken leg, the CPT codes tell them what they did to treat that. Were you seen in an office visit? That's what an E&M tells them. Was it a procedure? That procedure tells them exactly what was done. Then you've got your HCPCS, which is your HCPCS, and that's going to tell you any additional things that they use to treat you. So they're going to say, this is what was wrong with them. The CPT says this is the service we rendered to him, and the HCPCS adds on, what did we use to make that service happen? So that's what those 3 books are for. And again, it's the translation. So you're not just going to get one book and when you learn Spanish, you're going to have Spanish 1, Spanish 2, Spanish 3, right? So kind of the same idea here, to learn to translate that entire visit, to give them the full flavor of what happened, you got to know all 3 codes. So that's why.
And so doing a test, you take all 3 with you?
Yes, you do. Yep. Now the hick pick is not used as much as the other ones, but you really, really want to be very familiar with your CPT book. Have it appropriately tabbed. Now, what I've had people come in for tests before, and I feel sorry for them because they have over tabbed their book. And a couple of years ago, actually, Cindy and I and another chapter board member, Chris, did a class on getting prepared to take your CPC. And one of the things we did during it was we had them bring up their books to us and show us how they tab their books. And some people were like, okay, girl, you got to tab some more. And other ones were like, oh my goodness, take half these tabs out, you'll never find them. So it's what you need to do to find the chapter. So really, I would make sure that certain things are tabbed, like the grouping of each code. So anything that starts with a 1, and then a 2, then a 3, then a 4, 5, 6. You want to make sure that your modifier section is tabbed, things like that. With your ICD-10s, a little bit of everything maybe, but it's just how quickly and how familiar you are with the books. And what's really going to make or break it when you go to take your CPC exam is how, it's not that you're going to know every code out there, because that's just not possible. I've been doing it for 25 years and I can tell you, I don't know every code out there. But I know where to go find it, and I know where to find it quickly. And that's the most important thing, is if they ask you to look for a DRG, can you find the DRG? If they're looking for an abbreviations, where are my abbreviations? Where are my, where are my modifiers? Where are my, oh, I need to find my radiology codes. Where are my radiology codes? So instead of going, through your book, you've got it tabbed. So you can go straight to your 7,000 codes and go, oh, there's my radiology codes. That's what they're looking for. So that's why Cindy is giving you great advice by telling you to tab your books. The most important thing is get in with your local chapter, even before you take your test, and have somebody, and ask one of the board members to sit down and go over your books with you and say, gosh, do you think I've tabbed this appropriately? Do I have enough notes in here? Because you can write notes in the book. Again, it has to be appropriate and specific to what you're doing. But I really recommend, don't wait till the day of the test and we're saying, throw that out, throw that out, throw that out. No, you want to make sure you're prepared ahead of time. You spend a lot of time getting prepared for this. You're spending a lot of money and you're sit on your butt for 6 hours and take this test. So you want to make sure you've done everything you can to prepare. So take those books, and I've had it happen to me a lot. I've had people bring their books in saying, I'm testing next week. Can you take a look at my books and tell me, do I have it set up? Am I missing anything? And a lot of times by looking at it physically, we can say, you need to do this or take this out or whatever. And it really is going to make a difference. Finding that information at your fingertips is critical. So yes, all three books.
Yes, quickly.
You have about, we figured it out one time with 150 questions in 5 hours and 40 minutes, a little over 2 minutes per question. And there's going to be some questions you're going to be like, boop, I know the answer. And other questions you're going to be like, oh my God, what are they talking about? So you just want to make sure that you have a flow. I know where to flip. I know which book. I know which code I'm looking for. And you're going to have all 3 books on your table, and you're going to have your drink, and you're going to have, your worry stone and everything else going on. But you want to make sure that you know where to look for the answer. That's critical. And that's why Cindy's telling you to do that, because it makes the biggest difference. And after our training class, I believe we got great feedback. There were people that hadn't been able to pass the test like 2 or 3 times. And after the training and being able to understand the appropriateness of what those books are for and how to resource them correctly, we had people passing the test that had never passed before. So with Cindy, you guys have a wealth of knowledge and a direct line into AAPC, into testing and how they think. Use her, ask her, that is a huge, huge resource.
And I'm going to segue into that as you're talking about Cindy. Through my career lifetime, like I was mentioning before, you never know where you're going to end up. I actually had an opportunity to be an instructor at the college that I actually graduated from. I went to, a local accredited college. So I got to be an instructor. So you may find a passion with this in a couple of years and think, maybe I do want to be a teacher and teach this. So just opening that door up for you to think about.
This is wonderful. Thank you.
When are you going to retire, Cindy?
Pardon me?
When are you planning on retiring? So I can.
I don't know. I think I've still got a few more years left in me. Yeah. So I never thought I would be a teacher though. So, like they say, you never know where things are going to take you in that. So you guys have got a whole road of opportunities ahead of you, is just whichever direction you decide to take it in. And that I'm just kind of the cheerleader along the way.
Well,
Yay, another cheerleader.
Just another segue is one of the things that has been added to my job duties lately is that they are, okay, somebody is touching your face. Okay, that freaked me out because all I see is a hand. Sorry, guy has his hand coming around his face. I think he's got one of his little kids behind him. One of the things that has been added to my plate recently is my chief financial officer met with me and asked me to start taking a look at contracts. And normally you would not think of coding and billing and having anything to do with contracts, but we work with an outside physician company, and they wanted to make sure that they weren't double dipping in asking for payments on things that were the same thing. They don't understand coding, so they don't understand these reports that are coming in where the doctors are asking for specific payment. And so now I have brought in my palette to include contracts and contract negotiations. So it's something that's very interesting and very needed, because that's huge money that goes out the door, but something that 25 years ago, if you told me I was going to help negotiate contracts with physicians for how they're going to get paid, I would have said no. So, I mean, you just never know. It opens the doors into all kinds of things. And once you get your foot in the door, you're going to find your niche and you're going to find what you really like. And if coding is something that you really enjoy, I always say that we are the black and white people of the universe. We like rules. We like guidelines. We wanted to say, you do this, you don't do this. And so, like I said, the traffic stop, you know, who can go, who can stay, that is our wheelhouse. That is our comfort zone. We don't like a lot of gray areas. And so when you get your foot in the door, you will find that there is all kinds of areas that you can branch out into, because people need experts. They need people that they can trust. And my dad always said is have a piece of paper behind your name. Doesn't matter what that piece of paper is or where it's from, but have something that says this person has taken the time and the energy to learn something, and they're good enough that we're going to give them a piece of paper that says we're going to stake our name on it. And that's what we do as AAPC when we give you your certificate and you earn it. We're saying they've done the hard work to get there. They are somebody of value because you can trust them, because they had the dedication, they took the time, and they are now experts in this field. So that piece of paper, those little letters after your name, mean a huge wealth of knowledge. Remember how we talked about translating a visit into codes? That CPC tells me all kinds of stuff. That translates all your history and all your education to me. So walking in the door with that piece of paper already puts you above and beyond everybody else who's in line for that job.
I agree.
Thank you so much for that. It is my job to note that we are close to time. However, I do want to make this clear, and Andrea and Chelle are so helpful, and they want to help out here and kind of give you your feedback. So know that you can ask questions to Cindy. If there are more questions that you have that were not answered here, we can send these questions over to Chelle and Andrea and kind of get some responses via email if we need to, so that we can kind of get those going and make sure that you're not simmering on something you can get an answer to. Before we close out today, though, I did want to see if you are able to take a quick survey, because we want to continue to offer more of these events for you. We have some new ideas, some things brewing, and so we want to make sure that you have questions, that you're putting them in the survey so that we can really address them and then make sure to provide that support for you. But before we close, we cannot leave without saying a massive thank you, round of applause for Chelle, and a round of applause for Andrea, and a round of applause for Cindy for doing amazing work as always. Again, if you have burning questions, please feel free to email them to Cindy. She'll send them my way and we'll make sure to get them out. You will also get, this will also be sent to you in an email as a recording. So you can also go back if you missed anything that was heard. And then some of the resources shared here, we'll also share those out in communications to you so you can have them. But yeah, thank you so much. And feel free to stay on for a couple of minutes if there's anything that you needed to ask me. And I hope you all have a wonderful rest of your evening.
Good luck, everybody.
Thank you.
Good luck.
Thank you
so
much.
Oh, Cindy. Cindy, are you still on?
Yeah.
I was going to ask you a quick question. So since I'm going to be taking my exam in about a month and a week, could you look at my books to see? I think I've tabbed them pretty good. I know I'm going to she was just talking about tabbing modifiers. I know where the modifiers are in the hip picks. So I don't know if I really need to do extra tabs or not, but I might just